Now, America's healthcare advocate, Carrie Hall.
Hi, I'm Carrie Hall, America's healthcare advocate, and I have some information today on Medicaid that I'd like to share with you. If you're a Medicaid recipient or someone in your family is, or a friend, this is information you need to know. During the COVID pandemic, about 30% more Americans signed up for Medicaid. That brought the total to about 83 million people. Unfortunately, tucked inside the $1.7 trillion bill, the omnibus spending bill that funds the federal government, was a provision that allows states to start pushing people off of Medicaid that were on it during the pandemic. Here's how that's worked. The public health emergency was first declared in January of 2020 by President Trump. And what happened as a result of that was we had expanded Medicaid enrollment because they changed the enrollment procedures and made it easier for people to get on Medicaid. Well, that pushed the number up to about 83 million people. That was renewed every 90 days until we just passed the omnibus spending bill. As a result of that, the Department of Health and Human Services predicts that about 15 million people are going to lose their Medicaid coverage. That's the bad news. Here's the good news. 5 million of those are going to be eligible for the Affordable Care Act, ACA, or Obamoa Care, if you know it by that name. They're going to be able to sign up for ACA or Obamoa Care in what's called a special enrollment period. What that means is you have a qualifying event if you're on Medicaid and you lose your coverage. That qualifying event allows you then to qualify for an ACA or Obamacare policy. What does that mean? That you'll get a subsidy. That subsidy will cover a large part or all of your premium depending on your income level. That's important to understand. So you move from a Medicaid policy to an ACA policy. Here's some other things that are important to understand. The ACA policies are far better benefits than Medicaid, and while a lot of providers do not accept Medicaid because of the very low payment reimbursement level, almost all providers accept ACA Obamacare policies, Affordable Care Act Obamacare policies. How do you find out if you qualify? How do you find out what your subsidy is? How do you do any of those things? The easiest way to do that is to reach out to a professional, an insurance professional that works specifically in this arena of health insurance, a broker or an advisor or an agent. If you want to reach out to somebody nationally, there's a company called RPS Benefits by Design. Work very closely with them. You can call them at 877-385-2224. That's 877-385-2224. They'll be happy to talk to you about this issue and walk you through the process. Explain to you, here's what, based on your income, here's what your subsidy is going to be. That covers 80%, 90%, maybe 100% of your premium on an ACA policy. In addition to that, some folks on these policies will qualify for lower out-of-pocket, lower deductible, and lower co-insurance levels due to the subsidy and due to their particular situation with regard to income. So it's important to understand this. It's also important to understand this is going to start in April. So you're going to get a notice, and let me explain how that works. The legislation requires that states make a good faith effort to contact individuals whose eligibility is under review by multiple communication methods. That means that if you're going to lose your coverage, you're going to get a letter, you're going to get an email, I assume you may even get a phone call. They have that information. Also, the federal government is transferring all of this information to the states, so the states then can make a good faith effort to reach out. But if you want to preempt that, if you want to understand what you would qualify for under ACA, once again, you could reach out to the folks at RPS Benefits by Design. You can go to their website, rpsbenefitsbydesign.com, and reach out to them that way. Or you could call them at 877-385-2224, and one of their folks can help you see what you qualify for if you qualify. What I'm suggesting here is don't wait until the last minute. You're going to have 5 million people trying to do this at one time. All right. And the biggest problem is a lot of people don't know that they qualify for this ACA policy. That's why we're doing this today, to inform you that you do qualify in many cases for an ACA policy with a big subsidy that will cover all of your premium or most of your premium. It's really important to understand this, and I hope this really helps people who are going to get those letters and those notifications that they are off of Medicaid. I'm America's healthcare advocate, Carrie Hall, and I wanted to share this information with you today.